Okay, it's a challenge. Could you take a break from your smartphone? A recent study says that taking a break from the device, even for just 2 weeks, can have profound benefits for overall health. The study found that 91% of participants reported noticeable improvements in their mental well-being, attention span, and overall quality of life after temporarily disconnecting. Joining us to talk about that and other health topics, Dr. Jeff Pothof, UW Health's Chief Quality Officer. Good afternoon.
Hey.
I am so guilty of this. It's the doom scrolling. I was up until 1 o'clock last night watching reels, and it was not good.
Yeah, well, Kim, you're not alone. So this is an interesting study, and there's two stories here, actually. There's the headline, which is when you took these nearly 500 individuals and you installed an app on their iPhone that basically turned off their internet so they could make phone calls, they could send text messages, nothing else. And then you survey them and, kind of assess their mental health. 91%, huge majority of them say, you know what, my mental health was a bit better after not being on my phone. And I think we can kind of understand that. I mean, the online world is like the ideal world, compared to that, it seems like all of our lives are a mess, and it's a little bit depressing. But here's another interesting, if you read through all 11 pages of the study, they say, of those 500 people that were enrolled, how many of them didn't cheat, i.e. how many of them actually did go online? 75% of them cheated. They were like you. They were up at 1 o'clock in the morning reviewing their Instagram, even there in a study to try not to do that. So I think it just speaks to the power, how addicted we are to our phones and scrolling.
But you give me an idea. If I could just limit it to calls, that'd be zero. And text, I might be better off. Because no one talks anymore. Okay, let's talk about, there's a new injectable drug that possibly can deal with food allergies in kids.
Yeah, this is an interesting study. So the medication we're talking about is Xolair or Amlitelimab. And this is a medication historically since like 2003 used to help treat asthma. But what this medication does is it binds to the proteins in our blood that can be responsible for those anaphylactic or dangerous reactions that some people have, adult and kids, to say like peanuts, whey protein, other things that they have this reaction to. If you take this medication for a year and then we expose you to like a medium dose of the thing you're allergic to, you've got a 36% likelihood of not reacting to that, an improvement, or 36% of people in the study didn't react to that. That's better than what we see with oral immunotherapy, where you take a pill that's supposed to help tame your immune system down. I think that's good news. It's probably not the holy grail. I think the other thing, I'll let you in on a secret, any of these medications that have a generic name that end in MAB, monoclonal antibody, are extremely expensive. So we'll have to see if insurance companies are willing to cover these.
That's an extra for us. Okay, colorectal cancer, the rates are rising among young people. We're hearing about it, and it's also increasing our anxieties about the disease.
It is, and I think in all things there needs to be balance. So it is important to get that message out, especially amongst young people. And by young, we really mean about 45 to 50 years old. That's what we're seeing, increased rates of these colorectal cancer cases, and oftentimes, not great screening. We don't want people to be, freaking out about this, but at the same time, I think when you're feeling anxious, one of the things that's good to do is to figure out, what control do you have in this situation? And I think there's really two main areas that we have control. One, if we're 45 and older, we have the ability to get screened. Doesn't mean you have to go in for a colonoscopy. There's blood tests, there's stool tests, there's ways for you to know whether or not you have colon cancer. So if you're anxious about this, get screened. Two, I can't predict who's going to get colon cancer, who isn't, but I can tell you, if we live a healthy lifestyle, get lots of exercise, eat really healthy, don't smoke, things like that, you significantly reduce your likelihood of getting that. So focus on those things that you can control and not so much that uncertainty about whether or not someday you might come down with cancer or really any other medical condition.
Good advice, Dr. Pothof. Thank you.